My name is John Graeber. I'm a practicing dentist in East Hanover, New Jersey, and have been practicing with various aerobrasion techniques over the past 15 years. Recently, a new development was created by the Velopex company, the Aquacut, in that they have added water to the particle stream, thus reducing the amount of overspray or mess, as most dentists refer to it. And this has resulted in far greater comfort for my patients, as well as much more efficient cutting ability with this particular unit. We employ the Velopex Aquacut for mainly operative dentistry. It is used routinely to provide my patients with completely anesthesia-free treatment. No size cavity is contraindicated to using the Aquacut. The vast majority of patients, well over 90%, require no local anesthetic when we use this unit. The unit itself is far less expensive than the earlier versions of aerobrasion equipment. Aerobrasion equipment, when first introduced, was in excess of $20,000. Those units used high pressure with an onboard compressor. They're very efficient, but as most dentists who incorporated that into their practice found, the mess was uncontrollable without the use of exceptionally large vacuum units, and that the dust settled throughout the entire office. This pretty much put an end to aerobrasion as we now know it. Working with engineers in England, Sidney Grant developed and utilized the best of what was then the dry aerobrasion units and added a very simple device to bring the water. A very simple device was used to bring the water around the airstream. This is very important because it completely encapsulates the airstream, causing it to form a slurry once it hits the tooth structure, and that slurry is generally very easily vacuumed up with normal dental evacuation units by the dental assistant during the procedure. It has been my privilege to work with Mr. Grant and his company in developing new designs on the handpiece and for making suggestions as to the betterment of the unit as it was once given to me to use. The Aquacut does represent a huge advantage when treating caries in the oral cavity. It allows us to treat people with no anesthesia. It allows us to treat people with a unit which is a mere fraction of the cost of a hard tissue laser. In my opinion, when cutting through enamel with the Aquacut does in fact cut faster than any of the available hard tissue lasers. Unlike the dental handpiece, which the moment it touches the inside of the enamel during normal cavity preparation and causes significant microfracturing, regardless of the type of handpiece, the Aquacut is not capable of producing such fracturing. As such, we find that patients treated with the Aquacut have no or little postoperative sensitivity. The surface produced by the Aquacut is been shown to have a higher resulting surface of the enamel, once prepared with the Aquacut, has a much higher bond strength with conventional bonding materials. In addition to preparing natural teeth, the Aquacut is certainly capable and does very easily prepare dental materials for better bonding, such as porcelain inlays and even the insides of castings, which give the surface of the castings or porcelain an absolutely pure surface and much more porous surface to attach bonding agents to. The Aquacut uses a moderate air pressure of some 80 psi in order to cut structure. Units previously built required 160 psi in order to adequately cut dental structures. Because of its lowered requirements for air pressure, we can just tap into using a quick disconnect device the normal airline of the dental office. Because it has no onboard compressor, there are far fewer parts to go wrong, and that means far less maintenance and a far more reliable unit for perhaps 1/10 the cost of previous units. The major change in the design of the handpiece is simply this addition of 2 polypropylene pieces. One tube for the water and one nozzle, which allows the water to be drawn by Venturi action around the airstream, which comes from a typical dental handpiece. There are no moving parts within the Aquacut, and this certainly cuts down on the wear and tear on the insides of the unit. And simple vibratory motion due to air pressure shakes the powder out of canisters, which are all pre-measured, ready to be loaded into the unit. The Aquacut has 2 chambers, one of which can be used for Profi-type powder and the other one for aluminum oxide cutting powder. The chambers themselves are easily serviced throughout the top of the unit. The unit does have to be off and not connected, and there are no electrical components to this unit, making it again a far more reliable unit, relying only upon the tapped into office air pressure to power the unit. Aquacut has certainly modernized and made our ability to cut structure without use of dental handpieces far easier. It's a big step forward. I hope that you would join me in providing with your patients a most pleasant experience as they undergo routine treatment for caries. The Velopex is a 2-chambered instrument. On this chamber is usually filled with 27 or 50 micron aluminum oxide. And this chamber is usually filled with sodium bicarbonate, making this both a combination of a 2-chambered air abrasion unit as well as an equivalent of a Profi-Jet. The Profi-Jet the Aquacut has an advantage because of its advanced tip design in being able to contain the powder and slurry used with the bicarbonate of soda, which many hygienists find very, very difficult to be able to control. Sodium bicarbonate is an excellent stain remover and is an indispensable aid in providing patients with prophylaxis. The 50 micron powder is an excellent cutting powder. It also is able to prepare castings for cementation in a much more efficient manner than the 27 micron powder. The 50 micron powder has been shown to be a little bit more sensitive for patients who are not anesthetized, and the 27 micron powder, along with the water spray, is for most patients a completely painless experience with regard to cavity preparations well within dentin, and cavity preparations may extend down into dentin very, very close to the pulp, and still it doesn't change the non-sensitivity to the preparation procedure.